thank you for inviting me over here today. My name is Rockli Kim. I'm an assistant professor at the Division of Health Policy and Management at Korea University College of Health Science. I'm a global social epidemiologist studying the unequal distribution of disease burden across the world and also identifying structural factors that inhibit some people from living healthy and productive lives. So here at KU, I lead the Global Health Lab, where we work on a number of projects identifying and addressing the social determinants of maternal and child health in low and middle income countries. So for example, we use large-scale nationally representative population data sets to assess the importance of economic development and well-being, women's education and empowerment, and access to high-quality health systems in reducing preventable deaths and ill health among young children and mothers. Our research work collectively shows that more investments are needed on broader socioeconomic and structural conditions, and not just on the short-term provision of clinical treatments that global health projects often focus on. So some of these research work are done in collaboration with international organizations like the Asian Development Bank and UNICEF. I'm also the co-principal investigator of the Geographic Insights Lab together with Professor Subbu Subramanian at Harvard University. So we received a $2.2 million grant from the Bill and Melinda Gates Foundation to develop a web-based knowledge platform for policy research in population health and development. In a sense, the goal of this project is to provide tools to visualize and analyze the performance of policy indicators at multiple public policy units in India, including the districts, the parliamentary and assembly constituencies, and villages. We have published methodologies on applying advanced statistical modeling, geospatial analysis, and machine learning to estimate and predict the health and development outcomes at these units for the first time. And we're very excited to share that the final product of this knowledge platform will be released next year. And through this work, we hope to foster more rigorous, evidence-based policy deliberation, formulation, and action to improve population health and development. In addition to the Harvard Center for Population and Development Studies, the NITI Aayog and IIPS are the core partners of this project. So many of you would be disheartened to learn that even today, globally, 1 in 5 children suffer from undernutrition, and that 1 woman die every 2 minutes from preventable causes related to pregnancy and childbirth. Compared to all sorts of global health challenges we face today, the financial and human resources in the field are finite and extremely constrained. So then this begs the question of how can we do a better job in leveraging the information we have to use the global health resources in a more efficient and equitable manner. For this, our research lab plans to utilize data and data science approaches to enable more precise identification of high-risk socio-demographic groups with the greatest needs and targeting of small geographic areas with the largest local burden of disease in various countries. I'm also interested in expanding my research work on implementation and evaluation of health and social programs on early childhood health and development. So in the long run, I hope that through my research and education here at Korea University, I'd be able to make practical and meaningful differences in the lives of the most vulnerable populations around the world. So if you're interested in learning more about our projects, please do not hesitate to reach out to me.